Mr. President, I rise today to oppose S.J. Res. 13, which is a Congressional Review Act resolution to undo the regulations which protect Title X health centers. I believe that this resolution, although well-meaning, will have the opposite effect of its intention. I particularly want to discuss the organization known as Planned Parenthood. But more generally, these women's health centers, these Title X health centers, number one, provide many health care services to women, particularly low-income women. They are the choice of those women. They are a place that they have chosen to go to receive their health treatment. And I do think that one of the problems with this whole debate is the use of the term funding of Planned Parenthood. What we are talking about here is not funding as in a budget line or a budget provision that says Planned Parenthood gets $58 million or $100 million or $10, whatever it is. That's not the way it works. What we're talking about is reimbursement for women's health services provided on an individual case-by-case basis. And this does not include abortion, does not include abortion. And these organizations in Maine serve, Planned Parenthood, for example, serves 10,000 people. 10,000 women choose to get their health care services from Planned Parenthood. The other piece of this debate that I've never understood is why those who are opposed to abortion would be so opposed to organizations that allow women to make choices about pregnancies and provide contraception and contraception advice, which statistically we know reduces abortion. In Maine, because of the access to organizations like Planned Parenthood and other women's health care clinics, we've seen our teen pregnancy rate drop 58% in the last 20 years or so. 58%. That's a significant reduction, and it's attributable, at least in some significant part, to the availability of the services provided by these organizations. It's always struck me as ironic in the extreme that someone who says they're against abortion should be against an agency that provides contraception and family planning services that prevents pregnancy and therefore prevents abortion. I subscribe to President Clinton's formulation that abortion should be safe, legal, and rare. It should not be something that is chosen casually, and of course it isn't. This is a terribly difficult decision for a woman, but that's not the subject here today. The subject today is curtailing the reimbursement for women's health services to an organization or organizations that may also provide abortion services. It is contrary to the very idea of trying to prevent abortion, but it is also denying health care services of choice to thousands of women in Maine and millions across the country. I've sat in this body for 4 years and heard people talking about how consumers and patients should be able to choose their physicians. They should be able to choose their health care options. This was a basic principle, and it's one of the arguments that we've heard as we've been discussing other health care issues in this body. Well, this Congressional Review Act provision would take that choice away of who they want their care to come from. And I think that is a grave disservice to those citizens, many of whom are low income, many of whom are covered by Medicaid, many of whom do not have private health insurance. And to take this step that this resolution would entail would be very short-sighted, and it is, I believe, a violation of the rights of those people to choose their health care providers. And it also does not achieve the ends that the sponsors want to achieve. And that's why I believe that this resolution, although it may be denominated as something to do with being anti-abortion, I think is just the opposite. If this resolution passes and these health care centers under Title X, including Planned Parenthood, are unable to deliver these services, there will be more unwanted pregnancies and more abortions. I think that's a sad and unfortunate outcome to be perpetrated by people who say that they're trying to oppose abortions. Planned Parenthood provides women's health care services. It provides contraceptive services. I know the people in Maine that work for this agency, and I know this is a terribly controversial issue. But I believe that if what we want to do is minimize the number of abortions, then it makes no sense whatsoever to somehow indiscriminately strike out at the funding of the agencies that provide health care services. Nobody in this body is talking about federal funds for abortions. That's not what the issue is. If that were the issue, this would be an entirely different debate. The issue is taking reimbursement away from a Planned Parenthood clinic or a Title X clinic for mammograms or cervical exams or other women's health services. Why would we want to do that in the name of achieving some other goal that won't even be achieved? In fact, it will be made a more widespread issue. So I hope that the Senate will realize that whatever the motivation behind this provision is, that it just makes no sense. It makes no sense from the point of view of preventing abortion. It makes no sense in terms of the taxpayers. Preventive services, contraceptive services, about $200 per patient. A Medicaid birth, about $10,000. If it's a Medicaid patient, that's taxpayers. We're all talking about saving taxpayers money. Why would we want, and this goes for the healthcare system generally, why would we want to undo prevention? Whether it's prevention of unwanted pregnancies or prevention of some other disease. Prevention is part of the solution to the healthcare crisis in this country because of the excessive cost. Here's a specific case. And we're not, again, talking about funding abortions. We're not even talking about funding Planned Parenthood. We're not talking about funding these Title X health centers. We're talking about protecting them in terms of their reimbursement for women's health services delivered. That's really what this vote is about. If you vote for this, you are voting to take away reimbursement for health services that are necessary to protect the health and well-being of women across this country. I hope my colleagues will vote no on this resolution, and I believe that will serve the public, and it will even serve those people that are concerned most deeply, and I understand most deeply, about abortion. If you want fewer abortions, fund Planned Parenthood. It seems to me that's a fairly clear correlation, and it's one that we should respect, but we also should respect the rights and needs and choices of those millions of women who rely on these clinics for their health care needs, aside from the issue of reproductive rights. Just straight health care needs, and that's what this vote is all about. Thank you, Mr. President. I yield the floor.